Yeah. So it's been busy with children. Um,
Yes.
is it related to the pandemic in any ways?
Oh, I don't know. McKinley she was able to graduate in December from college, and went out to Minnesota for a week to help her move. Um, she decided to not do graduate school yet, but I think that was kind of in her plans anyway. She was going to wait till next fall. Um, and she has a full-time job. That did change with the pandemic because so many new jobs were offered online only. And
Hmm.
as a new grad, that wasn't something she
Hmm.
was really wanted to do. And she's doing some social work with patients with traumatic brain injuries or developmental disabilities, and she helps them at their jobs, her company, find a job, and then she's their coach.
And
She wanted to be able to get out and not be home.
yeah, where is she? Where is she living?
Minnesota, Minneapolis.
Okay. Um,
Yeah.
what was her degree in?
She has her bachelor's in, remember this, Mark, international studies, and then she has her minor in Spanish and a minor in global and media studies.
Okay. None of which prepared her for what she's doing now.
No.
Uh-huh.
Mm-mm. She spent in Fort Morgan, she worked at One Morgan County, which
Uh-huh.
is I don't know if you know what that is, but it's kind of our
I was
lead.
in on its inception, sure.
Very good. So she enjoyed that a lot. She did 2 different summers with them. And she did an internship with a similar group in Minnesota. So she thought she'd like to try some social work and see.
Uh-huh.
I can see her at that point being again in one of those situations like a One Morgan County or along the lines. She's fluent in Spanish, so that helps a lot because she spent
Did,
6 months in Cuba. So yeah,
wow.
yeah.
Did she have trouble getting a job?
You know what? She did not. Her professors were surprised. I think it's pretty reasonable. Like the hourly wage, she said it's like 16 and then it's supposed to go up to 19.
Hmm.
And she had a couple different interviews. And so it wasn't as hard as she thought it would be.
Hmm. Yeah.
But, and then Patrick, we moved to Tacoma. Oops, sorry. That was our other kid. He went back to school to Tacoma. He was on campus for a little bit last semester. I don't know if he probably wasn't when I was talking with you. They allowed athletes to come from like September to Thanksgiving. And then all of his classes were still remote, but they had small group practices. So now he's in quarantine for 7 days, and next Wednesday football practice should start more as a team. And there's 4 games scheduled.
Hmm.
There's no fans that could come, and they're just spring games. But he'll be able to play, he hopes. And he has 2 classes that will be in person and 2 that will be all remote, compared to all remote last semester.
Hmm. It seems to be the
Exactly.
new normal. It just seems to go on and on.
It's so sad.
Yeah, because even now there are vaccines, hardly anybody's getting them.
Hmm.
Have you, I,
Yes.
and Sean, I assume.
Yes. Yeah. We got him on the 29th, December 29th at Valley View, our first ones.
Mhm.
So yeah, I didn't have any problems. I had a big bruise.
Mhm.
That was about it.
I've um I've asked my doctor here in Chicago about it, and he doesn't know any more than I do
Hmm.
about if they'll be getting it at the practice. How do I get in line? It's just it's all still
Hmm.
up in the air unless you're in one of the first groups.
1A or
Nobody knows
1B.
anything.
Yep. Morgan County Health Department reached out, and alongside with Salute, they're now immunizing folks that are 70 years and older.
Hmm.
So like Sean's parents were able to get it, and a handful of people we know in the community. So they're considered 1B now in Colorado.
Oh, I should move there.
Yeah, you could come back.
I should move back. Yeah.
Yeah, just for a shot.
Mhm.
You could probably sign up on the Morgan County one. They have a link. But so that's kind of different. Yeah, I know my mom's in Chicago area, Oak Park actually, but
Uh-huh.
she hasn't heard anything either.
And work, how's work going?
It's It was a challenge. I was really pretty much done, feeling like I wasn't doing anything. And as far as my monthly work, um, we were allowed to go back into facilities in October, but then we were asked not again by CVS has been very cautious.
Mhm.
And even if our facilities wanted us, we had to go through a process to get approved to go into the building. Um, so I still miss my buildings and then there was a second outbreak. So everybody just said, no, stay home. I don't think I would do this job if it was going to be forever online. I could tell you that much.
Yeah. So you're really still not going to the facilities.
Not much. I went to Valley View for their clinic day, their vaccine clinic day, and was finally able to see charts. And then I went to another facility in Greeley, Grace Point, that I
Mhm.
consult for on their day, on their vaccine clinic day. But I mostly helped more with their clinic than walked around the building. So I'm
So were
hoping
you
January.
mhm. Were
Mm.
you screening patients, enrolling patients, giving shots?
Oh, no, CVS did offer us if we wanted to get vaccinated, or not vaccinated, sorry, vaccine certified. I
Mhm.
had let mine drop,
Vaccining.
but become a vaccinator, right?
Yeah.
So I did not, but I was helping the group that was the CVS pharmacists, and a lot of them came from Fort Collins,
Mhm.
and they did this big, what's the word, recruitment, and have a lot of new pharmacists that are. The gal that gave me mine graduated in May, and you could tell she was a little nervous. but it was, but I just tried to help as much as I could to make it go smooth.
Mhm.
I did some
Oh,
screening, answered questions,
mhm.
filled out paperwork.
Before I forget, for the record, I'm talking to Tamara Thompson, PharmD, who works for CVS, lives in Fort Morgan, Colorado, has lived there for a long, long time, and works as a
Yeah.
consultant through CVS to nursing homes and their pharmacy programs
Yep.
in the region. Yes. Um, so what kind of when you did work in this clinic, what kind of things came up? Were there issues that came up that as a pharmacist uh, y- that needed a pharmacist to address, and what were they?
hmm A lot of them were looking at drug regimens, someone, because they talk about being immunosuppressed. So someone who's chronically on prednisone for arthritis or so
Mm,
forth. If there's contraindications. We had one patient who had just received her pneumovax, so we had to look up the guidelines for that and little things along those lines. They had a lot of questions just to ask how it's going to work, and a lot of the staff had more questions than the residents actually, because
mhm.
they had quite a big staff turnout at the one in Grace Point, and a lot of them are still hesitant.
Yeah, and what's that about? What are their concerns seem to be?
It's hard. I think a lot of them have jumped on the bandwagon of it's so new, I'm not going to be a guinea pig type of thing.
Hmm.
We don't know enough about it. And, a lot of people have said that we usually take 5 to 10 years to get a vaccine and things along those lines. I think they've heard those comments and they're worried about that. I try to tell them my perspective and my research, the mRNA concept for a vaccine it was actually studied for years for HIV.
Hmm.
um, that so it's been there, and they do have some. So the concept has been there, not necessarily this vaccine, obviously, but I think, I mean, I know the studies show studies, but I think it's not as novel as they made it to be out, if
Hmm.
that sounds right, for the lay
Sure.
public to understand. Oh, we've never had a vaccine like this. That's not really true.
Mm.
I don't think that was represented well. And I also don't think COVID's being represented well. This is just me again, Mark, but I'm starting to see it's more like a smallpox, a diphtheria, a pertussis. If we start talking to people about a measles or a mumps, and it seems to be more like that because it has the long-term effects. It has the acute phase, but then it's airborne, it's droplet, and a lot of those diseases were, and we're able to take care of them. And not many people balk at the MMR or their DPT, those
Mhm.
other vaccines. So I kind of think COVID got, I don't know what the right word is, shortchanged in the description and just compared to influenza. And it's not. We're learning so much more. It is not comparable to influenza in many, many ways. Because now we're seeing people 3-4 months out that, were sick, intubated, got better, but now they're having like heart failure or kidney failure or issues that they did not have and were not on the path to, basically. And young people, like in their 40s and 50s, who were sick, are presenting with, disease states that should not be there, in most opinions. So I think the viral or the virus does have more of a virulent feature, and I think more education to people is definitely going to be helpful to let them realize that, because I still hear people saying, well, it's just like a flu shot. It's the same thing as the flu. And I wish as a whole, media and education would go out to try to compare it to other things, other viruses that we've taken care of with vaccines, and not keep it that level of influenza.
Yeah, I think it was minimized for so long for political reasons.
Yeah.
That people don't get it. They don't trust it.
No, I don't think so.
At your institutions that you serve, have you seen a lot of central nervous system complications, involvement?
Some, I've seen some paralysis, they presented like a stroke, but they've recovered. Blood clots were getting common, and folks were getting prophylaxis. Low molecular weight happened for a while. Mostly the confusion, but which is hard in my population.
Right.
Most folks
Because
do
a
get
urinary
ill and they get
infection can cause
confused.
confusion. Yeah.
Yep, exactly. Some of them, like folks that weren't confused, I don't know if that makes sense, but, had really good scores, like BIM scores and so forth going in, but then had the virus. And now afterwards, they're quite a bit more confused, quite a bit more forgetful. And, that's hard to adjust to. But not a lot of other CNS, but I did have 2 or 3 residents that had like some paralysis with the virus, not with the vaccine.
Okay, and it resolved.
Yes.
Yes.
Yeah.
So it sounds like for you, this is just getting hard to sustain, just because you're not getting back what we get back doing healthcare, which is
Exactly.
from the people.
Mm-hmm.
And for you especially, because I don't imagine you're doing face-to-face with patients or video face-to-face.
Right. No.
So you're
Not at all.
just interacting with staff and you're not seeing patients at all.
Mm-hmm. Yep.
In your interactions with staff, how do they seem to be doing?
It's like a new crisis mode I've noticed in long-term care. When I read the notes, it's, every shift, people are monitored for droplet precautions and along those lines. And then every shift, or you look at social services called family, discussed COVID restrictions. And so I think it's just a new way of that for them to document and to take care of their residents, which is different. There's been changes. When we talk about psych meds at my psych meeting, like psychotropic meetings, everyone's more concerned about doing a gradual dose reduction because of the scenario. And whereas before, they were due for one, they're not having any symptoms or so forth, they might have tried a reduction on their meds, but now with isolation and no families. And so I think, I see both sides. A change in scenario, but overall for practice, clinical practice, I think it has affected psych meds because folks aren't willing to decrease the dose or try something different, basically. Or we've had a lot more startups with depression and anxiety as well. A lot of more residents started on meds.
Yeah, they're saying that for the general population, maybe especially young folks, that's kind of the next wave of complications from
No, I could see it.
this pandemic.
Yeah, just like my daughter, she had 3 roommates. There were 4 of them, and they were so depressed. They were just different.
Yeah.
And that age group, college age, and it's really hard. And then Patrick too, he was home as a college freshman, and it really got to him. And it wasn't just the fact that he couldn't see his friends, it's the overall fear of what's happening in the world, for these environmentally concerned, diverse students that
Mhm.
have a beautiful view of what things should be like, a utopian view. They're pretty discouraged and scared.
They feel like they've inherited a world that's not in very good shape.
Right.
Would you put it that way?
Yeah, I think so. It's tough.
And the pandemic has made it worse.
I definitely, I think so. Yeah. And a lot of people are dropping out. I don't want to say dropping out, but stopping college or taking gap years,
Mhm.
trying to find jobs and trying to figure things out if that's really what they want to do, or so forth. So I think overall there's a lot of unrest in the age group. I would say from like 18 to 30, definitely, or 18 to 25 for sure.
Yeah.
Yeah.
I know at that age, at least in America, most people don't really know where they're going and what they're doing, but it's way more so, way more the case now.
No, I agree. Yep, I agree. So
And from what I understand, Colorado is starting to surge again.
I think so. We were in Washington for a week, so we kind of fell out of that loop in Tacoma,
Mhm.
Sean and I. But now we started looking at the numbers yesterday, and yep, I think they're going back up.
And
Um,
Sean went through some really terrible times at the nursing home, didn't he? With
yeah, it was tough.
the
It
first time
was
I interviewed
on
him,
all of us, but yeah.
we say more about that on all of us. It's a family disease.
hmm Oh yes, yes. Because Patrick was home, I was home. Sean isolated or lived in our bedroom
Uh,
at the beginning because we just weren't sure. I mean, his exposure is with PPE, but
yeah.
he was so concerned, didn't see his parents for weeks. Um, he and Patrick, Sean would be down upstairs in the bedroom and Patrick would be downstairs watching football games and they would be pounding on the floor and the ceiling to each other. So it was, they figured out how to communicate, but it was tough and it was hard to like make a dinner. And I'm glad Patrick was home because I think it would have been a lot harder on me to not have anybody to sit at the table with. But I'd make a dinner and just put it outside the door for Sean, and he would bring it in the bedroom and eat it. So it was different. We had gone through that with me because I was exposed, but it felt different for me. I think it was good to have our roles reversed because I didn't understand why Sean was so lonely
Mhm.
when I was in isolation.
Uh-huh.
Because I'm like, oh, this is quiet. But it was tough because he's also was dealing with residents and families and the health department, and
Yeah.
it was very frustrating. They work hard. The emergency visits of family weren't happening the way they thought they should be happening, so that's not good. And then you had family who was afraid to come
Mm.
inside because they didn't want to expose themselves or their mother or their father. It was a very hard time
Yeah.
because I mean, through the window, you watch your loved one die. It's definitely not the same as holding their hands.
No, it isn't.
No, and the nurses did great. I was very impressed. I mean, I know the inner workings of Valley View, and I know how concerned they were, and I know how they took care of everybody, and it was impressive. They tried to do, as much as they can when they had their residents on isolation
Mhm.
and so forth. But they're also been hit with, I just look at their management, every department's management, because their numbers are so low. I mean, you have people working overnight as a CNA, and there's so it's weird, the care
Because
has
the
been
patient
intense.
census is so low?
Hmm?
I mean, because the patient census is so low?
Right. But their care is so much higher, but they still can't staff with enough people, and volunteers weren't allowed. So it was hard. And then Sean, he'll probably tell you all this, but he struggled with after, because it started right before Thanksgiving, their first resident.
Mhm.
But people would have a mild case or no symptoms, but he said they're just puny. I don't know if that's the right word, but he said they're just
Yeah.
puny for weeks afterwards, and they wouldn't eat. And he that was really hard on him because he knew what their spirit was beforehand, and he's like, I can't do anything. And we like to help people. And so it was interesting.
I've been interviewing, we're re-interviewing a lot of the people who we interviewed before. And I'm glad we're doing it because just the tone has changed so much. Everybody's tone has changed so much.
Hmm.
I think that's a real important thing to document and see and to understand.
Yeah, I could imagine. It's
Everybody is fatigued. At the
it's
beginning, people would say, we're all fighting the good fight and we're in it together.
yeah.
We'll all figure it out and we'll get through it. And now, people are saying, how much longer do we have to do this?
Right. And
Yeah.
I think part of the frustration is, as a healthcare provider myself, is when you see people, I don't know how, but people not wearing masks and people not following the guidelines, and people you think are relatively intelligent. And they're like, no, I don't need one. I'm not going to be a sheep. I'm not going to be, I'm not going to follow some recommendation. And personally, that's been hard for me. And folks that have been exposed, but they don't want to tell people they were exposed because it might close their work or it might
Mhm.
change something at their kid's school. And the concept of public health, I don't think is really good out there.
No, it's
I
true.
think it's still a me population and it's my health and what I want to do. But that's been hard personally for me to swallow with some of my friends and
And that's
acquaintances. But
and that's pretty much the case all over Northeast Colorado, I understand. Um,
yes, yes, but it's all right. I did a project. I want to hear about my community service project
Absolutely.
because it kind of helped me take care of my residents. I contacted, well, Patrick was home and a couple high school seniors, and then I made a list, what they call a sign up genius. You could do this online, and sent it out to a bunch of 4-H groups, just a lot of people in schools. And we decorated the 3 nursing homes in Morgan County, the outsides. We made pallet trees. We cut out trees out of pallets and painted them green, and I put solar lights on them. And kids made garland out of, cereal or whatever they could. And I probably had about 40, 50 yard signs that people painted. Marla Stump ran for an election, but she had a bunch of signs left over, so she donated them, and we just painted over them. And then they had Christmas scenes or, Bible verses or just positive sayings. And we had probably overall, when I think about who signed up, probably 20 to 30 families and people making bows and then the day to hang stuff up. I kept it small because I didn't want a lot of people exposed, but I had great volunteers that helped me go set everything up at all three buildings. So that was fun. And then we had some elementary kids make little trees, just something little for every resident. So they knew people were thinking about them. And to me, the most important thing was these kids realized where they were going with this and who they were serving. I think that's, the nursing home residents tend to get forgotten a lot. And when we discussed this with, I knew quite a few of the kids from my swim team and their parents and, church groups, and just they knew what they were working on and where it was going, which to me is really important. And so that was a fun community service project I did.
So you say your swim team, you're a swim coach?
I'm on the board. Patrick swam. I'm on the board. We have a team here in Morgan. It's seasonal, just outside, because that's all we have. So May to August.
So did you go in the summertime? Did they?
You know what we did? We totally revamped everything, and we have 6 lanes. So yeah, we used that Sign Up Genius thing again for practices, and we had like 15 minutes of warm up, 30 minutes in the pool, 15 minutes out, and we just had them. They were a circuit. We had, let me remember right correctly, almost 50 swimmers return. And the year before we had 80 something. So we had a great turnout. Families were very excited just to get their kids to do something. The pools were great. We used Brush and Fort Morgan pools. Our coaches, yeah, we had 6 coaches this year, and it seemed to work well. We didn't have any swim meets because nobody was doing competitive meets. So the coaches tried to keep it fun, but still the kids got so much more attention because they're in the pool with 5 other people and there's 4 coaches. So a lot of people said they liked that better than our hour and a half practices with 40 kids at a practice.
Right.
So, I mean, that is a positive. We might have hit on something that we might do different for scheduling, at least maybe a couple days a week instead of having the big practices, have these smaller ones. So that I would say is a positive, but the kids were good. They listened. They kept their distance.
So in your case, you've managed to maintain some safe contact, and
Mhm.
that's the connection, and that's been
Yeah, definitely. Yeah, and
um,
that's yep.
do you, and that's been one of your most important ways to cope.
I think so. Um, I worry a lot about kids. Just I also had a friend who her daughter, they kept her home. She was supposed to be in first grade. So
Mhm,
she came over every Wednesday and we did science. And
mhm,
I tried to just, folks like that I know that all of a sudden they have to homeschool is pretty hard.
mhm.
So just me personally, yes, I tried to do as much as I could for kiddos at different schools and different places because I think it would be really hard to be a kiddo and not have your friends and so forth. And then the
Have
poor
have
parents.
you have you been able to maintain most of your local friendships?
Yep, I think so. Texting helps. I think for the most part, I mean, I'm not a huge social butterfly, but the
Mhm,
people I still text with and an email, or when we do these projects, I had people come over with masks and they would just take their gear. And so it was along those lines.
so I'm curious,
Mm.
are any of your friends from before the pandemic anti-maskers? And have you been able to stay friends in spite of that?
My close friends were not anti-maskers. Um, I don't really think I lost any friends over it because it's just people that I knew of.
Okay.
Yeah, I don't think so. And everyone was really good with respecting our house and Sean, and which we appreciated greatly
Mhm,
because, people would just, we wouldn't go somewhere or we'd be out with the masks and they didn't make us feel bad or, they just knew our view on it. And it just kind of went that way, I think. I know Sean didn't go out at all, but for the most part, just in general.
mhm,
But yeah, I don't think really lost any friends that way.
mhm. So have you all been getting outdoors too? I know Sean is big into riding horses.
Right.
Are
And
you
his
all getting
bike.
outside? And bicycles, right. Well,
Yes, he
yeah.
still bikes to work every day if he can. And then other rides. I just get out around the house on our land, walk around with the dogs, my chickens. I got new chickens, so I was able to raise them through all of this.
Are they
And
layers?
yes, yes. Yeah, I had 2 left that were pretty old, so I got 4 new ones.
Mhm.
And so that was fun because the 2 that were left were not, I want to say loving chickens, but they weren't, but some of my new ones are, so they follow me around.
Oh,
They're my friends. And walks, yeah, mostly just that for me personally.
yeah.
And Patrick got outside a lot with workouts. He had to do so many workouts for football every day.
Uh-huh.
So, yeah, I think so.
do you think you're going to keep when either? Well, you think you're going to keep doing this when the pandemic's over? You
What do
used
you
to really
mean?
like your career, right?
Yes.
Yeah.
Yeah. I I like my job when I can go into my buildings. So we'll
Has this
see.
made you rethink what you want to do for a career?
Probably.
Yeah.
I just, yeah, I don't know.
Mhm,
I mean, I miss the connections, obviously,
mhm,
and visiting with people and helping people in any way I can. So
mhm. Well, it sounds like you're doing a lot.
I
You know, to be
try.
more creative about it, that's just kind of work for you.
Yeah, we try.
Yeah.
And Patrick was able to graduate. They had it outside.
Oh, nice. Good.
They had it on the football field, and there were 12 students, so that helps out at Prairie.
Yeah.
But they actually had the ceremony,
Mhm,
which was nice. And were able to have a little to go party for him when we canceled the one in May, and then when he was finally leaving, we thought he was leaving August 1st. We had a little get together with close friends, and we were all outside, and that was very nice too,
yeah.
because he enjoyed that. And we set up campers for awnings, and
Mhm,
everybody was again respectful. And like my niece Kelly works in Denver with the homeless, and she had her mask, and Sean and I, but we didn't make people wear masks, but we had them out there. But
mhm,
it was a good time. It was a good time. But yeah, you just hear a lot of, oh, you're so sorry for your kids, so sorry for them. They're missing this, they're missing that. But
How long since you've seen your daughter?
oh, McKinley, I seen her. She just came home.
Oh,
She
nice.
came home once. Let me think this through. In May, because she
Mm,
was going to come home anyway for Patrick's graduation. And she and Patrick did a road trip, which was wonderful because Patrick needed to get out of Morgan County.
mm.
They went up through Wyoming and Idaho and Yellowstone and went
Oh, that's
camping. And
beautiful.
they spent 10 days on the road together. So that was wonderful. And then she came back again in October. We bought her a bird for graduation, so she had to pick it up. And a parrotlet in Denver. And then I went there and moved her in December, and then she came home for a while. So
Mm,
I've been seeing her. I haven't seen my family in Illinois at all. That's been hard. My mom, she doesn't like video anything. So,
mhm.
and my great aunt, or my aunt, a kid's great, and my brother and his kids, and I haven't. This is the longest I'd say ever I've gone without seeing my mom, because it was since October of, I don't know. I don't know if it was October of not, no, last year was, yeah, 19, October of 19,
Mhm.
because we were going to go in March and then everything hit.
Yeah, I haven't
So
seen my kids and grandkids
that would be so
in a while.
hard.
You know, I really don't wanna fly if I don't have to, and I don't have to.
Yeah.
Um, yeah.
We've flown. We just flew Friday coming back from Tacoma, Sean and I.
Mhm,
So we flew to Tacoma. I did a round trip in September, and Sean did a one way back with me because he drove with Patrick. And then just last Friday we went. I pay more, and we went Alaska Airlines and had the middle seat open.
mhm,
We had KN95s and goggles. I mean,
mhm.
we debated a lot about even doing it, but we did it, and I was impressed with the cleanliness. And
Yeah,
it's funny though, because I was just focused, don't touch anything, don't touch anything, don't touch anything, like the handles or anything, and just constant hand sanitizer. So it was a little different trip, but
yeah.
it was doable.
I've recommended cardboard mailing tubes over the elbows.
That's a good idea.
Yeah,
Didn't think of that.
yeah, that would that would remind you. Um, oy.
Yeah.
Oh, so let me just ask you, not germane to this at all, but did you grow up in Oak Park?
No, and actually, I think I'm wrong. My mom's in Oak Forest.
Oh, okay.
I grew up right outside of the city on the south side in Burbank.
Okay.
So it's like 79th and Cicero area.
Yeah.
And I always say Oak Park, but she moved to Oak Forest to an apartment. Her and my dad, we built a house in Lamont when I was in high school. And then since my dad's gone, she has an apartment in Oak Forest.
And I grew up on the north side, so it's like a different city.
Yeah, it is. It's totally a different city. Yeah. It's kind of funny. Patrick just has a new running back coach, and it's the father of one of the other coaches, but he went to Weber, Archbishop Weber High School in
Uh-huh.
Chicago, and he knew like the school my brother went to was St. Lawrence, and it was just
Yeah.
there's so many people out there. Now he's in Washington coaching Patrick, and they have all this stuff in common. So
2 degrees of separation.
mhm,
And in
it's
Northeast
weird.
Colorado, it's 1.5.
Yeah,
Yeah.
probably. Yeah, because he did know the coach did know the two boys from Fort Morgan that are playing football at CSU right away when Patrick said he's from Fort Morgan. The guy's like, so, yeah, but it's it's different. I like Chicago.
Yeah. Yeah, me too.
Yeah.
Although I don't get to Chicago, I'm just stuck in the burbs. Nobody's going anywhere.
Yeah. We noticed that on Thursday in Tacoma, they had this art walk where it was the first year they ever did it, but Sean and I tried it. There was downtown buildings that were going to have art,
Mhm.
but it was so empty, the downtown on a Thursday night. And there was a couple people following the art trail, you could tell because they had the same app that we did, but it was never thought about a city being dead. I mean, Fort Morgan to me is always Fort Morgan and it's not Chicago. So
Right.
but we had been to Tacoma before this, like when we went and visited last year, and to see it that dead and desolate was an interesting feeling. It was quiet. It was weird.
Have a lot of businesses bitten the dust in Fort Morgan?
Not that I know of. There's been a lot of disagreement with the county commissioners and the governor. And the commissioners think we're okay and we can be wide open, but
Yeah,
I
same
don't
in
know of
Weld
anybody
County.
that's closed.
Yeah.
Yeah.
And how about the Northeast Health Department, which is like 5 counties?
Yeah, it's
Uh,
huge.
have they have they been at all apparent or active in all of this? Do you ever hear from them? And
I
are they,
do. I'm on an emailing list with them, and regarding the vaccine, I just got on, but then Sean was on it otherwise. I
hmm,
know the facilities use them a bunch and call with questions when like so and so was exposed, and they'd call the health department and they would give them some guidance because you needed to follow your local health department. Um, I've seen like a lot of ads from them in the paper and articles around here. I don't know about like Logan and the other counties, but
are they clashing with the county commissioners?
I think so.
Yeah, yeah, because
I
it was epic in Weld County.
yeah, I believe so. Um, but I didn't see that much lately. But yeah, yeah, I know the commissioners are very upset about businesses and
Hmm.
things along those lines.
So I assume your restaurants are still mostly open for indoor dining?
No,
No.
wait, I mean, no, a lot of them put out like I don't know, like patio dining that you can
Mhm,
do that. And they've covered them up with tents, which
mhm.
doesn't make any sense to me. I think that's still right now, or they just was changing again this week with going back to red. So I'm not sure. We have very good friends that own El Jacal in Fort Morgan. It's one of the
Oh, yeah.
Mexican restaurants. They're good friends. Their daughter is Patrick's girlfriend. So we've heard everything through them, and they've had a lot of changes. And I helped them in the beginning when it was everything locked down, and I helped them like to write a letter that their delivery people can carry, and stuff again I would never think of because supposedly you weren't supposed to be out and about during that those times. And then they went to all delivery or pickup, and then a little bit of an open, but then a little bit of close, and it would be a nightmare I think to run a restaurant right now.
A lot like how it's been with, both the in healthcare with the
Yeah, that's
virus
true.
and precautions and now with the
Hmm.
doing and who gets what when. It's
Yeah,
constantly changing.
it is. But I think, I mean, I know financially they did okay when they weren't dine-in.
Mhm.
Um, there was a group that, I don't know if it was new or not, but Morgan County, something on Facebook, Morgan County Dine and Eat. I think
Mhm.
it was started during the pandemic, and a lot of people joined, and the restaurants could put up their specials.
Mhm.
And I thought that was a great idea. And, or somebody can show, like, I went and ate here, this was great. And just to support local restaurants was a big push
Good.
around here.
That's good.
My girlfriend, or friend, a really good friend of mine, owns the Flower Peddler, the
Mhm.
florist. And unfortunately, she's been swamped with funerals.
Mhm.
But her business overall took a dip, she said, but
But they're hanging
she's,
on.
yeah, she's still there working. Yeah, I think they completely closed for about a month, maybe.
Mhm.
And then and then because there was no funerals, but people needed memorials. And
Yeah.
so just again, another area that I would not think of affected.
Yeah. And alcohol.
That supposedly went up a bunch.
Yeah, I'll bet. Um, and has your company been good in supporting you through all of this and getting you clear guidelines and
think so, yes. We started having a national call every other week, which was very helpful.
Mhm.
Um, and we heard about, again, things I wouldn't have heard about, but they were all just clinical pharmacists and nurses from Omnicare. So it was all long-term care based, and what was happening around the country. And then PPE they've provided for
Mhm.
whatever well, not whatever, but what I've requested, they ship to Valley View and I got at home. Uh, they've been, yeah, I think they've been supportive. The vaccine has thrown us all because CVS is one of the companies
Mhm.
that CVS and Walgreens at every facility and home and, long-term care, assisted living, group homes. Um, so they're in the middle of scheduling an astronomical amount of clinics. And they've asked us to help with contacting. I was assigned, I don't know, 80 buildings that I'm the point of contact, and all of them are in California.
Hmm.
So that was, I'm
That's
not a
interesting.
fan of that at all, because
That's not what you went to pharmacy school for.
no, not at all. And I really feel bad for the full-time folks because they've had that laid on them. Plus, they did let 6 pharmacists go from my team in June, I think. So August 1st, we all started with more buildings. So that part has been hard.
Mm.
I don't understand. I laughed the other day and I said, I wish they would just hire like a temp service of administrative assistants, because all I'm doing is moving around files in a spreadsheet
Mhm.
and telling people, well, your clinic is this day, your clinic is this day. It took me 3.5 hours this morning to get caught up just on that. I haven't,
Mhm.
and you feel for the buildings that are contacting you because they're a small group home in California and they want their residents to get vaccinated, and you're their link. And I'm
Mhm.
like, I'm sorry. But so that's probably the biggest negative, letting go 6 pharmacists and then now having to
Mhm.
be an administrative assistant. Point of contact, that's the word.
Yeah, that somehow sounds better, right?
Yeah, I'm a point of contact.
Yeah.
But so I guess, yeah, the vaccine clinics have our company is taken. I mean, they're busy, busy, busy.
Um, One more thing I wanted to ask when you mentioned that in your larger meetings, that you've learned some stuff that you wouldn't have heard otherwise. Can you give an example of something that's been of use that you've learned from talking to people from around the country?
Um, Actually, yes, the areas that were hit harder, like New York and LA, though they would give us a lot of input on the clinical protocols that were being used.
Mhm.
Because again, especially, I mean, Valley View and Sunset, my buildings really weren't in that first wave.
Yeah.
So I was able to have that data, and they would, let us know about the dexamethasone versus,
Mhm.
and then the like the hydroxychloroquine if they had any residents on it and what they did. So it was nice to have that experience. I mean, from another pharmacist that does the
Right.
same job as me. Like, this is how we handled this surge in our, I mean,
Mm.
that was good. And the PPE requirements and just little national tidbits, like who was getting hit really hard and
Yeah.
where the numbers were coming.
Yeah. Speaking of Chicago and Chicago news, well, I don't think it's just Chicago. CVS was acquired by United Healthcare, right? And United Healthcare just removed Walgreens from all of its plans.
Oh, see, I
Uh,
didn't even know that.
and so, especially there are places, in the west side of Chicago, for example,
Mm-hmm.
where CVS is miles away.
Interesting. I didn't hear of
And
that.
it's just left all these deserts.
I bet.
Yeah. Anyway.
I didn't know. I know CVS, I knew they took over Aetna, fell under their umbrella, but I didn't know
Or
anything about
vice, maybe
United Health.
it was Aetna. Yeah, not United, but it was.
Okay, yeah, and Aetna came under their umbrella, I guess. But
And so,
yeah,
yeah,
I didn't think of that.
Aetna won't allow Walgreens now.
That just doesn't seem right.
I know, it's just,
I mean, I look here, we don't even have CVS in Colorado.
yeah,
They run the Target pharmacies, that's it.
yeah.
So
There
yeah,
used
that
to
would
be a
be,
CVS in Greeley. That may still be there.
there's a Rite Aid. I
Oh,
don't know.
yeah, that's right. That's right.
I don't know, but yeah,
It's
it's
not.
different.
So, well, we've talked about how you're keeping going. I hope you're sleeping well and taking care of yourself. And
I try.
yeah, all right.
Oh, these lights are weird.
Yeah. Um, oh, and in case it hasn't been clear, for the people who are viewing this at some time in the unspecified future, you're married to Sean Thompson, who's a physician who is the physician leader at Valley View Villa in Fort Morgan also. So that this Sean she keeps mentioning is Dr. Sean Thompson.
Yes.
Um, well, so anything else you'd like to share or you feel you want to get out?
No, I just I just wish people would be more open-minded. We're always going to have that wish.
And you're referring especially to person precautions and vaccine.
Yes. Yeah. And physical distancing and
Yeah,
we could probably get it probably. I mean, but that's just it. We don't know for sure if we could ever get a really good handle on the spread, but I
well,
would think.
yeah, we're better than what we have, certainly.
Yeah, I think so.
Yeah. All right. Well, you take care, and of
You
course,
too.
give Sean and your in-laws my regards. And